So what brought me into medicine initially was that my mother had this horrific car accident when I was fairly young. I was about first grade, and it was really daunting to be in the ICU and visiting your mom and having these, really intelligent and caring physicians come in. And not that I really understood the medical jargon at the time, but it made a lasting impression. What's exciting with the development of endoscopes and other robotic technology and the delivery of local drug-eluting stents and other medical breakthroughs is that surgical intervention for rhinology is extremely minimally invasive. Looking at a patient who has standard sinus surgery, you would never know they had surgery. Afterwards, they feel considerably better and their symptoms significantly improve in terms of frequency and severity. The impact and the severity of having this headache, this sinus pressure that may affect your ability to focus at work and just enjoy the daily aspects of life, including spending time with your family, is debilitating. And to be able to make a significant impact, even if it's not something as initially severe as cancer diagnosis or other things, it makes a huge impact on someone's day-to-day life.